Hey YouTube, how you guys doing? This video is gonna be on preconception. Okay, so how do we deal with this patient? Like, what's the routine with them? Okay, so for preconception, there's goals for this patient. Risk identification related to pregnancy. Patient education related to conceiving or pregnancy. And also interventions to mitigate risks. So those are the three goals for this patient. So we want to look at risk factors and health history. Okay. So the first and most obvious risk factor would be age. If your patient is over 34 and she's trying to get pregnant, she should be aware that there's more of a risk for complications for the baby due to like her eggs being not as quality. Okay, also at that age she's more likely to have pre-existing conditions, so that puts her at higher risk for complications in pregnancy, such as gestational hypertension or something like that. Okay, so also if the patient is young and maybe trying to get pregnant, can become pregnant, then that is a risk factor as well. What happens with adolescents a lot is partner doesn't stay with her, so she ends up being alone throughout the whole pregnancy. So she needs a good support system. And sure, there's other risks as well. Like, that's a whole other video. And there's laws regarding privacy that we should be aware of as nurses when dealing with the adolescent. Because there's things like you don't have to tell the parents. So there's things that can be between the healthcare team and the team and that adolescent, okay? So you have to be aware of your state's laws. STIs, STI status and STI screening. So that would be another part of, risk factor identification, mitigating risk. So we want to educate on, how to stay safe from these STIs, especially when we're dealing with adolescents. And also we want to check their status. Are they diagnosed with any of these? Have they had a history of any of these? And are they positive now? And do they need a screen? So if they feel like, hey, it's a possibility, then we would screen for them as long as the provider allows that. So yeah, that's it with STIs. Then you have your gynecologic history. Do they have any gynecologic surgeries in their history? And do they have any kind of gynecologic conditions? Okay. Also screen for substance use. Vaccinations. We need to know their vaccination history for certain diseases such as rubella. So certain vaccines you can get during pregnancies, certain vaccines you can get preconception, other ones you can get after. And the baby would get vaccines, I believe, too, for certain ones. So that would be in a postpartum video. So let's not go off on any tangents. So vaccine history. Other thing, I didn't write it down. I must have got distracted. So you definitely need to get your baseline vital signs. What is their baseline blood pressure, especially because we want to be looking for preeclampsia or gestational hypertension. And if they do have chronic illness such as diabetes, we want to know, their A1C, like if they had that done with their primary care, what is it? Maybe we can get that on file or have it done ourselves, like whatever the procedure is with that. That's more like up to the doctor, but we need to make sure we have it. So any baseline numbers with, like, let's say they have thyroid, we want to know their levels of their T3, C4 and all that. Okay, Now we're on to like their pregnancy history. So if you're working, if you're out there on the job, you're gonna get GP and report. All 3 reports I got in my OB rotation, I got GP. So that's just what they give you and report. G is gravida, and it is number of pregnancies that they had in their lifetime. P, I forget what that word is. I want to say para, but I forget. Like parity, I forget. But the P stands for number of births to viable gestation. That's your GP. So if you get a G3 P1, you should be thinking like, all right, what happened with those other 2 births? Because you have 3 pregnancies and only 1 birth viable to viable gestational age. So that prompts you to look at GTPAL. So it gives you all the information on their pregnancy history. One thing you need to remember is twins equal 1 pregnancy. So if you have twins, your G is, for those twins, your G is going to count as 1. Okay? I believe twins count as 2 births, but you have 1 pregnancy. And they would be 2 in living children. Twins were term, that would still count as 1. The only time twins are 2 are living children. Under pregnancy, they're 1. Okay? A lot of people just get their test questions wrong because of that. So term pregnancies would be pregnancies that ended 37 weeks or more. Okay. Preterm pregnancies would be pregnancies that ended between 20 and 36 weeks. And then you also have to include the 36 weeks and then the 6 days, because it's not till you get to 37 that it's term. All right, so those 6 days still count. Abortions, how many of the births were spontaneously aborted or artificially aborted before 20 weeks, okay? And then you would count those up. And living children, that's pretty self-explanatory. So you will get a question on your test. You will. I hope I explained this good enough. So you'll get a question like, your patient has 2 kids at home. She had 1 spontaneous abortion, and the 4-year-old at home was term pregnancy, and the 3-year-old at home was a preterm pregnancy. Then she had the abortion, so she has 2 at home. So that's 2 living, 1 abortion, 1 pre, 1 term, and then she was pregnant 1, 2, 3 times. And she's pregnant now, so that's 4 for G. So you just put your tally marks, you know, on where they apply. So it's hard to explain without like writing out a question and giving you an example, but that's basically what it would be. I'll link a video of Nurse Sarah, registered nurse RN. She had a good video on it. And the other thing besides all that you want to figure out is their past pregnancies. Were they vaginal or were they C-section? And did they get anesthesia? And if they say yeah, then you would just ask if they had complications from the anesthesia, and then you would ask, did they, in any of those pregnancies, did they have any complications like eclampsia or something like that? And then I just threw a Nagel's rule. This will give us the patient's estimated date of delivery. So it's, you would ask the patient, when was the first day of your last menstrual period? And if she says January 2nd, you would add 9 months to January. And then to the 2nd, you would add 70. So that would bring you to October 9th. And 9 months from January, you're still in the same year. Say this was June 2nd, 2022. And you would add 9 months to June. So that would bring you to 2023. So make sure you pay attention to the year. And don't be too focused on the month and the days, okay? A lot of people get that wrong because they forget about that year. And they forget that twins are one pregnancy. They're 2 living children, but they're 1 pregnancy. That's basically it on preconception. If you have any questions, let me know. If you watched this long, thank you so much. Please hit like and subscribe. I appreciate it a lot. And that is it. I will talk to you guys soon. Bye.